Hello, my name is Rocky. I'll be doing a newborn assessment on our newborn here. First thing you want to do is wash your hands. So we're going to use our imagination to wash our hands here in the sink. And then you got to get between the fingers and the nails. Pretty much get a good wash in there. Hand hygiene is important. So once we're done here, we'll go ahead and glove up. Imagine these gloves. We're in the box. All right. Okay, now that we're ready to go, we're going to first check the patient, make sure this is the right infant. Usually the ID band is on lower leg. So we need the poo, date of birth today, which is May 4th, 2020. Big guy. Okay, so now we're going to go ahead and assess, get some of the vitals of the patient. First thing we'll do is get the temperature. For a kid, you want to get like axillary temperature. You want to put the thermometer under the armpit and then hold that patient or hold the infant's arm down, get a good reading, make sure they don't try to squirm out of this. You just wait for the beep, and for this reading we'll get 99. Next, what you want to do is check the brachial pulse. That's usually located along the inside of the arm, a little past the axillary. For that, you hold it for a minute just because a kid's pulse rate's pretty high, so you want a good accurate reading. So you hold that count for about a minute and we'll get a reading of 150. Next is we're going to assess the infant's respiratory rate. Infants also have a high respiratory rate, so you want to count for a good minute. The rise and fall of the chest. Also want to note that it's an even rise and fall. Make sure good lung expansion for both sides. And for our situation, we'll have a respiratory rate of 52 breaths per minute. Okay, so next we're going to do is go ahead and measure the circumference of the head. We'll measure the length of the infant first. And then for this, we'll go ahead and use our little handy dandy measuring tape here. You'll want to go from the bottom of the feet all the way to the top of the head, and we got a measurement of 55 centimeters. And next we'll go ahead and put him on her on a scale, so we could just imagine this is the scale, and ideally you want your weight in kilograms. So ours was 7.2 pounds, or 7 pounds 2 ounces, which equates to about 3.2 kilograms. Next thing we want to do is assess the head. For that, we'll have to get a measurement of the diameter of the head. We want to be careful not to push any soft spots or anything on the kids. So you just want to kind of shimmy it under there and then go along. There we go. So we got about 34 centimeters. And now we're gonna, after we assess the shape of the head, we're gonna go ahead and assess the sutures. We have the coronal suture, the metopic suture, sagittal, and the lomboid suture. You also want to assess the two fontanelles, the anterior and the posterior. Make sure there's no depression, which would indicate signs of dehydration. And then you obviously want to check for any hematomas or any trauma sustained during delivery. This client was delivered with forceps through vaginal delivery with the use of forceps, and he sustained some. It's on this side, some trauma to the right cheek. Okay. Next, you want to do is check the alignment of the ears with the eyes. Obviously, it's a little difficult because Winnie the Pooh's ears and eyes aren't like humans, but you want that line that goes straight down from the corner of the eye to the ear, and then that other line that crosses at a perpendicular angle to that. And you want that line to meet kind of that, when those two lines meet, you want that to be the middle of the ear. For the ears here, the ear structure and alignment is normal. Like I said, we're just pretending here. There's no evidence of pits or skin tags. There is, and again, we're just gonna pretend here. You want to look for down slanting or up slanting. You want that nice horizontal imaginary line that goes from each corner of the eye. Nose, you want to assess the nostrils. You want to assess the patency because kids breathe through their, or excuse me, infants breathe through their nose. You want to make sure there's no obstruction or congestion in the nares or in each nostril. At this time, you can assess the mouth, make sure there's no discoloration or any abnormalities. You can also, at this moment, assess the suckling reflex, where you insert your finger, not too deep, but just enough to where you insert it into the mouth, and the infant should begin to suck on your finger. At this point, you can also assess the roof of the mouth, both the hard palate and the soft palate, to make sure they're both there and intact. You also want to assess for any cleft lips at this time. There's also you also want to assess the mobility of the tongue. Which you could do for this is lift the tongue, and it should touch the superior aspect of the mouth. Next is the neck. You want to make sure there's no excess tissue folds around the neck or along the top of the shoulders. Both clavicles are intact and free of fractures, which could happen if a kid's born if it's too big, or a shoulder dystocia. Okay, next we're going to assess the chest. What you want to do for the chest is you want to assess the sternum, make sure it's midline. Also make sure there's no depression in the chest or any curvature of the sternum or the thorax or rib cage. And then what we could do is assess the infant's heart. Okay, so we're going to go ahead and and you want to do this for a good minute to get an accurate reading. Make sure you get that apex as best you can. Kids' heartbeats go pretty fast, so you got to be there got to have a good ear. Okay, so heart rhythm is good. There's no murmurs noted. Okay, so next we're going to go ahead and assess the infant's breath sounds. Okay, so we'll start on the anterior side of things. Okay, and then next you'll want to assess the posterior side. So if you have somebody with you to hold the baby up, or possibly on their side to help you assess the posterior area or posterior side of the lungs. Okay, lung sounds are clear, good. Bring the baby back. Okay, next we want to go ahead and assess the abdomen. You can also, we're going to go ahead and auscultate the abdomen, make sure that got some bowel sounds going in there. Good, all clear. Next, you just want to gently, in a circular motion, feel the infant's abdomen. Make sure you don't feel any masses. Ideally, you don't want to feel the liver. Yeah, right side. It should be protected by the right side of the rib cage. And then next, you want to assess the umbilical stump. Make sure it's free of, it's dry and intact. And then there's no hernia near the umbilical, there's no palpable hernia on the umbilical stump. Okay, and then now we're going to move on to the groin, what we can do is go ahead and make sure we palpate the femoral arteries on both sides. Make sure they're nice and strong. Make sure there's blood flow going to both legs. Good, good. Okay, while you're here, you can also feel for inguinal hernia. Good, there's nothing there. Okay, our patient is a female, so you'll want to go ahead and assess her her vagina and her groin. So we just bring her legs up. There are times where there's skin tags or excess tissue on newborns, so you want to assess for those, any drainage or leakage of anything. Make sure you note that down. For our patient there, we'll just use our imagination and say there's none there, okay?
Go.
Okay, now we're going to assess for the hips or for hip dysplasia. Let's go ahead and turn it in that way you know what I'm doing. For this, you want to bend the client's legs at the knee joint. So I'll do my best with Winnie the Pooh here. And then abduct them internally, bring them internally and then extend them out. What you don't want to hear or feel is like a click or a pop. So this patient's, you want that posterior pressure also. This patient's hips joints are non-existent because it's a teddy bear, but we'll just say it was good to go there. Next we want to do is assess the hands and the digits. Make sure they appear normal to the size of the hand. The digits appear normal to the size of the hand. You don't want them too long or too short. And there's also times where there's an extra finger tissue. Okay, now we're going to go ahead and assess the hands and the palm. For the hands, you want to make sure the digits seem appropriate to the size of the palm, that they're not too long or too short. There's times where there's an extra digit or tissue that looks like a digit. Those can always be taken or removed surgically. The palms, you want to look for creases in the palms. You want more than that, just that horizontal crease. You want at least 3 or 4 creases that run into one another. Next, what we're going to do is go ahead and assess the patient's back. There's times where there's discoloration back here. A lot of those are normal, Mongolian spots, things like that, redness. What you don't want to see is a dimple with no observable endpoint, if that makes sense, because that would indicate a potential spinal or spina bifida issue. And you also want to make sure the alignment of the back is as straight as you can assess it from there. Okay, now we're going to assess the infant's neurological status. We're going to go ahead and, in this situation, our infant will be awake and calm. We're going to go ahead and just check his muscle tone. You do this by grasping both arms and lifting them up slightly. For your kids, the head will typically kind of fall back, but you don't want it to fall back, the head to lag no more than 45 degrees. You should note brief neck control and head movement. Then we can proceed to go into the Moro reflex, which is when you lift the infant above or up from the bassinet a few centimeters and support his head with the other hand, and then just drop him slightly. His arms should open and extend and then contract back in. Next, we got grasping reflex. Pretty much you just thumb or whatever finger you want. Put pressure in the palm and the baby should grasp. So you want to check both of those right there. Our rooting reflex is you just kind of slide or glide your finger along the cheek, and then the infant should turn and start to suckle on the side of the cheek that you did that to, kind of anticipating a feeding. Next, we're going to go ahead and assess the Babinski reflex. At this time, you can also assess the bottom portion or the plantar portion of the foot. Make sure you have creases there. But for the Babinski reflex, you want to stroke the length of the bottom of the foot up At this point, if the Babinski reflex is intact, the big toe will dorsiflex, while the other toe, forward remaining toes, will separate out and extend. That would indicate a intact Babinski reflex. Next is the tonic neck reflex. For this, you want to, for example, if for the tonic neck reflex, we would rotate the client or the infant's head, let's say to the right in this situation, at which point the extremities on the side of which the kid's or the infant's facing would extend, while the extremities on the opposite side would contract. And then you do that for the opposite side. In this situation, these extremities would contract while these other extremities would extend. And finally, to assess the gestational age of the infant, our infant was born at 40 weeks and 2 days, so that would put him at 40 weeks, 2 days for his gestational age. Thank you.